important to start this conversation about safety, just uh, differentiating safety and risk, because I know that in conversations we've had that those are not the same thing. Can you clarify the difference there before we dive in?
It's important to understand they're not one and the same and that you can't do one before the other. So in the case of risk and safety, you need to evaluate risk before you can define the safety measures to address that risk.
I love what you said there about evaluating risk before defining the safety measures in research facilities. Can you elaborate by giving us a specific example of what that looks like?
So when we look at lab spaces, we look at things like chemical use as a simple example, where if you know that the science is going to require chemical use, you need to evaluate what types of chemicals and is that chemical going to be changing state or phase or vaporizing or creating a hazard for the breathing zone, in which case that science or chemistry work would need to be done inside of a fume hood. So that's probably at the simplest analogy would be the risk would be chemical use, and you wouldn't want to do that open on the benchtop. You would want to perform that science inside of a fume hood. And that fume hood creates an engineered safety, which is a physical device. And then there's training to use that fume hood properly, which is the second layer of the safety to make sure that the scientist that's using the fume hood uses it properly so that they protect themselves and the environment around them.
And when do you evaluate risk and safety? It sounds like at the beginning of a project.
In the concept phase, in kind of the macro programming phase, to understand what is being done in the space. And a lot of times the researchers are not used to having these types of questions put in front of them. But once you explain the purpose and the rationale behind the need for the information, they tend to get on board pretty quickly and actually really embrace the process as they get to understand how their space is going to function and then the value of the space, the value of the safety and the risk, and the value of the energy that's consumed by that space all feeds into a smart scientist, process and allows them to be part of the solution as opposed to just a user of the space.
It's really powerful being a part of the solution instead of just a user in the space. Sounds like something everyone would want. Another question for you, Ray, just changing gears here. How can clients make sure they're designing their facilities safely?
I think it's important to make sure that you evaluate what you're doing in the space. So the scientists, while they may not know specifically what they're going to do, research is a very broad category. So if they want to repurpose a lab to do research for, biochem versus just chem or just bio, to use a simple analogy, they need to make sure that they're addressing all of the potential hazards that could take place within that work group or that science type, and then create the appropriate safety measures. That could mean fume hoods, could mean biosafety cabinets, it could mean additional air changes, it could mean additional filtration to address all of those things. But you have to understand the hazard, the risk of the hazard, before you can start layering those safety measures on top.
Are there any sort of resources and guidelines that are available to support safe design?
There's the biosafety level hazard document that's created by NIH and CDC. There's the design requirements manual for research labs that's created by NIH. And there is several standards from ASHRAE and ISPE that help you design safe research labs.
And Ray, important last question for you. How much can this cost? It sounds like it could be expensive, but do you have any tips for designing a safe lab while on a budget?
So in terms of cost, you need to make sure you understand the hazards and the risks, and then you need to start doing your concept and design development packages such that you're mitigating that risk. And when you have the systems in place to address the risk or the hazard, you can start to layer on the cost associated with those systems. And if you need to save money, you might need to remove risk. You might need to say, well, we're not going to use, say, that chemical or that biological agent in that larger room. You might say you're going to create a smaller environment for that higher risk element, and then you're able to isolate it into a smaller space and therefore sometimes reduce the total cost of the project or the cost of mitigating that risk. But it requires isolation of that process in most cases.